Hi, I'm Youngla, and I'm a student pharmacist here today. I'll be demonstrating how to perform an anterior nares nasal swab. To start, you want to make sure you have all the necessary supplies. You should have a sterile cotton swab and proper PPE. For the ease of demonstration, I will not be wearing proper PPE as I'm going to perform this test on myself. But you want to make sure you have gloves, a mask, or the appropriate PPE for your setting. Alright, then you want to evaluate the patient by asking them, have you had any surgery to the nasal passages recently? Next, you want to explain what the patient can expect with the nasal swab by telling them, I'm going to insert the swab into your nostrils to get a sample for testing, and this may be uncomfortable and you may feel some pressure. Before you start the swab, you want to make sure you're sanitizing your hands or washing them thoroughly with warm water and soap. I will be using hand sanitizer for this demonstration. Then you want to make sure that the patient is in a position that allows for easy access to the nose. This would mean that the patient's nose is at about eye level and instructing them to look straight forward. I would also encourage the patient to close their eyes during the process. Before you start, you're going to look discreetly at the patient's nose to see if it deviates to one direction or has a structural blockage. This is to make sure you know the general direction of the patient's nasal passage. You should also identify the nostril that has the most nasal secretions, because this will be the nostril that you want to start off with. Okay, with the nasal swab, you will take the sterile swab out of the packaging and you will hold the sterile swab in your dominant hand, holding it between your thumb and forefinger. Next, you want to insert the swab at least half an inch inside the chosen nostril. After inserting the swab, leave it in place for 10 to 15 seconds while rotating against the nasal wall. Then, using the same swab, repeat with the other nostril. Okay, I will be demonstrating. Alright, next nose. 9, 10. Okay. After finishing collecting your sample, you will place the swab inside the transport media and store it appropriately. Alright, this is the conclusion of the anterior nares nasal swab demonstration. Alright, moving on, I will be demonstrating on how to collect an oral specimen through a buccal swab. First, you want to make sure you have the necessary supplies for specimen collection. This includes a cotton swab and transport media. Depending on the setting, you want to make sure you wear the proper PPE. Next, you will ask the patients a few questions to properly evaluate them. Ask them if they had anything to eat or drink within the past 30 minutes, if they used nicotine products in the past 30 minutes, or if they brushed their teeth or used mouthwash in the past 3 hours. If yes to any of them, inform the patients that they might have to wait for best results. After you evaluate the patient, you will let the patient know what to expect. For example, I will tell the patient, I'm going to insert the swab into your mouth and collect a sample from your cheeks. This should not be uncomfortable. Then, you will sterilize your hands by washing them with soap and water or with hand sanitizer. Today, I will be using hand sanitizer. Alright. Afterwards, you will position the patient in the manner that allows you to easily access the collection site. The patient's mouth should be at your eye level and they should look straight ahead. Encourage the patient to close their eyes and let them know to sit still. Using your dominant hand, you want to insert the swab into the patient's mouth, firmly rub up and down against the inside of the cheek for about 5 to 10 seconds, and immediately after, you want to repeat on the other side. Okay, I shall just demonstrate on myself. All right. When removing the swab from the cheek, it is important to make sure you want to avoid the teeth, lips, or other surfaces. Lastly, you want to place the swab inside the transport media and store it appropriately. And this is how you collect a sample, an oral sample using a buccal swab method. Thank you.